This is an updated video on all of the myths about water because I found some more data about water that is just utterly ridiculous. Okay, these ideas that people have in their mind. Let's talk about the first one. By the time you're thirsty, it's too late. You're already dehydrated. That is utterly ridiculous. I don't know where people got that idea, but it's kind of like you could say that about eating. By the time you're hungry, it's too late. You're starving. Your body has all these different perceptions. Thirst is one of them, and your body will let you know when it's thirsty. I mean, I don't know who's pushing this idea that we can't go by thirst anymore. We have to drink before we're thirsty. Our bodies have the perception of thirst, okay? Unless we have brain damage, a tumor in our brain, maybe some type of autoimmune condition to our brain, or it could be that you're just not having enough salt in your diet, okay? And so your blood is very diluted, and you're going to get rid of the sensation of thirst if you don't have enough salt. But you should really go by your thirst. Just drink when you're thirsty. All right, next one is you should drink enough water until your urine is clear. Your urine should not be clear. It should be slightly straw color or yellow. That's the normal color of urine. If your urine is too clear, you're too diluted. Now, if your urine is too dark, okay, that also doesn't mean you need to drink more water. That means that you might have a liver issue because the liver has something to do with getting rid of that pigment. Now, if your urine is a little bit foamy, it could be more of a kidney problem, or it could be you're consuming a little bit too much protein. All right, the next one. You need to keep drinking so you're going to be full, so you'll eat less. Like the water is going to stay in your body, right? Drinking more water is not going to help you lose weight. Now, there is data that shows that if you replace your sodas with water, yes, of course, you're going to lose weight. You're consuming less sugar water, but the water itself doesn't help you burn fat. All right, the next one. Drinking more water will flush out your toxins. Most of the toxins are fat soluble. They're stuck in the fat cells. You're not going to detox by drinking a lot of water. That's not going to happen. All right, next one is water will prevent dehydration. Well, yes, you do need water for hydration, of course, but you also need electrolytes and sea salt, which is actually electrolyte as well. Because what's going to happen is you're going to drink all this water, you're going to dilute a mineral called sodium. There's a condition for this. It's called hyponatremia. That means low sodium in the blood. You can get swelling, edema in your brain, cramping. You're going to feel weak. You're going to get a headache. You're going to get irritable, and you're going to have cognitive problems, and you could even go into a coma. Let me tell you a real life situation. Even in my practice, I've had people come in that had high blood pressure. They're on a diuretic, okay, which, by the way, lowers their sodium. They're told to drink a lot more water. So now we're really diluting that sodium. They're doing sodas, they're doing tea, and on top of that, they're exercising and they're sweating. And they're getting all these side effects. So anytime someone's trying to hydrate, yes, think fluids, but also think sodium as well. But definitely don't overdo it. Drink when you're thirsty. Your body will tell you when you're thirsty if you listen to it. If you're exercising, if it's hot outside, if you're sweating, if you just did a sauna treatment, or you drank a lot of alcohol, you need to drink a lot more water. If you're at risk for a kidney stone, drink at least 2.5 liters of fluid a day. So again, I'm not against water, but I am against drinking massive amounts of water when you create other imbalances. Another point about fluids is that drinking a lot of water right before you eat, and you could drink right before eating, it's not going to be a problem. But if someone has, let's say they have acid indigestion, okay, they have heartburn, and they get bloating, it could mean that they don't have enough stomach acids. It might not be the greatest idea to drink a lot of water right before you eat, especially if you have those symptoms. And I already talked about this, but if you have kidney stones, you want to consume at least 2.5 liters of fluid every single day, preventing this super concentrated urine. If you have gout, uric acid crystals, one thing you can do is you can add a little bit of baking soda to the water to alkalize it, which would then cause the gout symptoms to reduce. Now, if you have kidney stones, you can add lemon water because the citrates will bind with the oxalates and prevent the formation of oxalates connecting with calcium. Now, if you go on the low-carb ketogenic diet, okay, and you're not consuming enough salt, and you're drinking a lot of water, that can throw off things as well. You might feel weaker. You might have what's known as the keto flu or keto fatigue, when really you just need more salt. The next thing that you hear, drinking more water is really good for the kidney because it keeps the kidneys clean and functioning. There's this idea that if you keep flushing the kidneys, they'll be purified. No, that's not true. You're just causing the kidneys to work a little bit harder. It's not going to clean out the kidneys by drinking more water. The kidneys filter the blood, and they recycle a lot of things in your blood. But drinking more water doesn't necessarily clean out the kidneys. There's no data that says that's true. When you consume certain foods, like vegetables, for example, 80 to 95% of those vegetables are water. You are getting a good amount of water from your vegetables. Even meat is between 60 and 65% water. And when you are burning fat, you're generating water. Because when you oxidize fat, you generate water and CO2 in the mitochondria. In fact, you'll generate a little more water than the fat that you're burning because of the oxygen. So in other words, let's say, for example, you burn 1 pound of fat. You're going to make a little more than 1 pound of water. It sounds incredible, but it's true. But please don't rely just on that water. And then it's okay to get most of your water in certain parts of the day, but I wouldn't necessarily ever force yourself to drink too much, because the water intake is an individual thing and there's so many variables, and what one person needs might not be good for another person. As far as thirst goes, your thirst can go up if you're a diabetic. Your thirst could also go up if you have too much calcium in the blood. But both of those conditions, diabetes as well as too much calcium in the blood, it's called hypercalcemia, can also cause excessive urination. So that's probably why you're thirsty. So I hope you have a little more knowledge about drinking water. If you have not seen my video on carbonated water, I think you might enjoy that. I put it up right here. Check it out.